Have you ever encountered the term stroke recrudescence in the medical record documentation and wondered how to properly code it? Today's ICD-10 quick coding tip will provide you with a clearer understanding of which codes should be assigned when this term appears in the medical record documentation. My name is Claire and I'm an inpatient coding auditor and educator. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. Recrudescence of a stroke or cerebral infarction is the recurrence of stroke-related symptoms from a previous stroke. The term recrudescence can be found in the alphabetic index. When referencing this main term, you'll find subterms for deficit and sequela that direct the coder to see sequela infarction cerebral. Therefore, following this guidance in the alphabetic index, it is correct to assign sequela codes for conditions documented as due to recrudescence of a stroke. Let's take a look at an example. According to the H&P, the patient presented with dysarthria and has a history of multiple cryptogenic strokes. The physician's plan includes an MRI to rule out an acute CVA. According to the discharge summary, the reason for admission was a suspected CVA. The discharge diagnosis is recrudescence of stroke symptoms. The narrative documented under the hospital course states MRI negative for an acute infarct, dysarthria attributed to previous infarctions. In this case, the patient presented with dysarthria and due to a history of multiple strokes, a CVA was suspected. Workup included an MRI which was negative for an acute stroke. Although a stroke was initially suspected, it was ultimately ruled out, and we should never code a diagnosis that has been ruled out. Instead, we'll code the diagnosis after study, which was identified as recrudescence of stroke symptoms. As I previously discussed, when we reference the main term recrudescence, we're directed to see sequela infarction cerebral. So referencing sequela infarction cerebral as directed, we see that there is a more specific subterm for dysarthria. Therefore, we select that code and validate it in the tabular. The code description for I69322 is dysarthria following cerebral infarction, confirming that we have arrived at the correct code for this patient's diagnosis. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up. And if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.